I'm Bob Bonow from the Bloom Cardiovascular Institute at Northwestern University and Northwestern Memorial Hospital in Chicago. The whole field of valvular heart disease is evolving very rapidly and in very exciting ways because of the new options that are emerging for the treatment of our patients, both early in the course of their disease and also later when patients are older with advanced comorbidities that increase the risk of surgery. On the mitral space, I think we're seeing great advances initially with the MitraClip, which is a way of attempting to repair the valve. In patients who are high risk for surgery because of their age and comorbidities, otherwise having valves that could be repaired surgically, but are not candidates for surgery because of the high risk involved of their other diseases. The MitraClip offers a very innovative and exciting way of giving them a treatment option which previously was not available. So this is where it's an approved device in the United States for management of these patients. The other exciting area is in the area of functional mitral regurgitation, patients with heart failure, high risk for any intervention we do, where they have secondary forms of regurgitation because of the left ventricular dilatation and remodeling. Here the MitraClip also is being used in Europe in a large number of patients, leading to very favorable results, including improvement in symptoms and quality of life. In this country, this is not yet approved for that use. It's a subject of ongoing clinical trials. We're waiting expectantly for the results of these trials so that we can begin to manage our patients as well. But the other area where there's a great interest in the kind of evolution of less invasive procedures for mitral regurgitation is in the area of transcatheter mitral valve replacement, with very innovative trials and device design that's going into the current evolution in the field, so that in the future we're hoping that the higher risk patients who for one reason or another are not optimal for surgery might have other options to manage their disease. But first and foremost, I think we need to kind of drill back down to the other issue we have in this country, and that is many patients who are good candidates for surgical mitral valve repair, and in some cases replacement, are also not being referred early enough in the course of their disease to the point where we now have to think of these other options when they have more advanced disease and are now no longer good candidates for surgery. So I think it's a combination of getting patients involved in a good heart team, cardiologists, cardiac surgeons, and the cardiologists are both interventional as well as the non-invasive imaging physicians and nurses to pull together to identify the right targets for our patients and the right timing for them. So as we evolve into the management of our complicated patients, many of whom are older, who need interventions for many forms of heart disease, valve disease in particular, we're really talking about evolving the heart team concept. What is a heart team? The heart team is a multidisciplinary group of experts, surgeons, cardiologists, which include invasive interventional cardiologists and non-invasive imaging experts, and nurses, many times also anesthesiologists, who are coming together to provide the best care for patients. This has got to be more than just the words saying we have a heart team. You know, it's got to be true diligence and dedication to providing the best care, bringing together the best people, and also providing the best outcomes. So it's bringing together the best people, providing the best care, demonstrating that we have good outcomes based upon this approach. This is how we're going to be tackling many forms of complex disease, not only valve disease, but also coronary disease and heart failure. It does bring together the best people to provide the best care at the best time for our patients.